Good afternoon and welcome. I'm Christy Truesdale, Deputy Director of the Children's Environmental Health Network, and I want to thank you all for joining today's webinar, Mobilizing Society to Take Action to Protect Children's Environmental Health. This is our fourth webinar of the 5-part series, Protecting Children's Environmental Health, the Blueprint in Action. Please make sure to join us for our last webinar in November to learn of exciting efforts to build political will to place children at the center of decision making. Before we get started, I am just going to go over a few logistical items. All lines are muted and will remain muted throughout the presentations except for our speakers. You may submit questions at any time using the chat box on the lower left-hand side of your screen. And we are going to hold on to the questions until after all of our presenters have spoken. And we'll do our very best to answer as many questions as we can. This webinar is being recorded and it will be archived on the Children's Environmental Health Network website by tomorrow for your future use and sharing, and I do hope that you will revisit the webinar and share it with folks that you think would be interested. And I encourage you to expand the conversation online. Share what you're learning from the webinar on Twitter using the hashtag #ChildrenAtTheCenter. Lastly, a very brief evaluation survey will pop up at the end. Please take a minute to complete this survey so that we can use your feedback to help make this webinar series as meaningful and helpful as possible. So with that, I'd like to introduce our moderator for this webinar, Nsedu Obat Witherspoon. Ms. Witherspoon is the Executive Director of the Children's Environmental Health Network, where she organizes, leads, and manages policy, education and training, and science-related programs. For the past 19 years, she has been a leader in the field of children's environmental health, serving as a past member of the NIH Council of Councils, on the Science Advisory Board for the Centers for Disease Control and Prevention, and the External Science Board for the Environmental Influences on Child Health Outcomes NIH research work. She is a co-leader for Advancing the Science and Health Initiative of the National Collaborative on a Cancer-Free Economy Network. Ms. Witherspoon is also a board member for the Pesticide Action Network of North America, the Environmental Integrity Project, and she serves on the Maryland Children's Environmental Health Advisory Council. Nse?
Thank you, Christy. I want to thank everyone for your time this afternoon. Welcome to this webinar. Thank you, Christy, for all your incredible time and energy you put into all of these educational platforms for us. The Children's Environmental Health Network, just briefly, for those of you that don't know, we are a national nonprofit organization simply dedicated to protecting all children from environmental hazards, and we've been doing that work for close to 30 years now. These webinars, as Christy mentioned, this is our fourth this year, are an attempt to offer a platform, an educational platform, an engagement platform, resource learning platform for everyone who's interested in protecting children. We developed a blueprint for protecting children's environmental health, a call to action for the field and for those who work in the field of protecting children around 2015. And from that, we have identified ways that we are mobilizing, high-level recommendations and needs and gaps from that report that included a lot of multidisciplinary leaders across the country over the time of putting it together. The themes that are drawn out in this report include creating knowledge and using existing knowledge in the field, establishing a connected children's environmental health community, marshaling the engine of the economy, mobilizing society to take action, and building the political will. And there is a preamble in the front of this blueprint, which is online on our website, cehn.org, that the next generation must be better off than the last, and that we have a moral obligation to protect and nurture children's health. And again, this vision of a society that puts children at the center, that is what is driving us, that is what our whole motivation is for allowing these educational platforms to come together and highlighting some wonderful partners out in the field doing just that. So our webinar series is based on the 5 blueprint recommendations I've just mentioned. This is our 4th, focused on mobilizing society to take action to protect children's environmental health. I do want to mention that October 10th is Children's Environmental Health Day. This will be our 4th annual Children's Environmental Health Day. It's always the 2nd Thursday of every October, which is Child Health Month. It is a day of raising awareness about the needs to protect vulnerable populations like children from environmental hazards, a day of mobilizing towards action. So it's one day, but it's a way for all of us to take stock and take a step back and think about how we can do better and more, because there's always room for that. And it also helps to anchor our larger children's environmental health movement that also came out of the blueprint that I talked about previously. So this is just a screenshot of part of our Children's Environmental Health Day website, and you can promote the day. That's extremely important to get the word out and let your colleagues, your neighbors, your friends, your family, those you work with know about this day. You can make it official by helping us obtain a proclamation on children's environmental health by your governor and or mayor. And that's extremely important as a tool and resource for advocates and community leaders and just interested citizens to lean on as you're trying to engage with elected officials. It's kind of hard, I think, to have a proclamation on protecting children and then to be doing, unfortunately, just the opposite. So again, that's usually a very viable engagement tool we encourage folks to use. There are letter campaigns that you can quickly sign on to, and obviously sharing your story and sharing what you're doing and how you're promoting the lives of children and promoting nurturing and growth and development. And then this is a screenshot of our action page. And I should mention there are toolkits, there are proclamation toolkits, there are promotional toolkits all on our site here. So we've kind of done a huge amount of the legwork for you. And our hope is that you utilize your platform, your leverage, your influence, your connections to get the word out. You can add your activities on our map, and activities are defined in however you see fit. Any activity with and or for a child promoting their health and well-being from environmental hazards all counts. It could be a letter, it could be a meeting you put together, it could be some forum you're organizing, it could be resources you're developing or have developed. All of it counts, and it helps because all actions that are uploaded here help to inspire others in the country to take action for children. So our wonderful presenters today, again, thank you to our 2 lovely partners here joining us. We have Michelle Madsen, who is the staff scientist for the Healthy Communities Program at Earth Justice. And prior to this, she worked in the Office of Child Health Protection at the U.S. Environmental Protection Agency as an Oak Ridge Institute for Science and Education Fellow. Michelle received a biology degree from Howard University and graduate degrees from the University of Michigan. Her research experience has taken her to Mexico and India, among other places, to address issues ranging from children's environmental health to sediment changes in the East Antarctic ice sheet. Michelle is also a board member and chief advocacy officer for Black Millennials for Flint, a DC-based grassroots environmental justice group working to reduce lead exposure and assist affected communities, and she's a member of the NAACP's Climate and Environmental Justice Committee. And then we have Kristin Schaeffer, who is the Executive Director of Pesticide Action Network. Before joining PAN, in 1996, she worked for the World Resources Institute's Sustainable Agricultural Program as a communication specialist for EPA, and as an agroforestry extension officer with the Peace Corps in Kenya. Prior to stepping up as Executive Director to PAN, Kristin was PAN's Program and Policy Director. She's held many roles at PAN over the years, including coordinating the International Persistent Organic Pollutants Campaign under the Stockholm Convention and the global campaign to phase out methyl bromide under the Montreal Protocol. Kristin has been a lead author on several PAN reports, including Chemical Trespass, Pesticides in Our Bodies, and Corporate Accountability, Nowhere to Hide, Persistent Toxic Chemicals in the U.S. Food Supply. She co-authored both A Generation in Jeopardy and Kids on the Front Line. And she also speaks conversational Spanish. So we are thrilled to have both of you joining us. And we will start with you, Michelle. Thank you so much.
Thank you so much, Ense. I hope you all can hear me. Again, my name is Michelle Madsen, and I'm very grateful for the opportunity to speak with you all today to do some knowledge building on key children's environmental health issues. And also I'd like to thank all of you who are on the line for what I'm sure is your very great respective work in this field or in your respective fields, and also for your interest in this topic today. So I'm going to go ahead and jump right in and make sure I can actually control my slides. Let's see. That it moved. Okay, there we go. So I just wanted to go ahead and do some framing for folks on the line. I'm sure many of us have done a deep dive of the blueprint, an urgent call to action to protect children's environmental health. But as I was doing some thinking for framing this work, I really wanted to do some highlighting of this first recommendation, because it's actually, even though this is not the first topic within this webinar series, again, the Mobilizing Society to Protect Children's Environmental Health is one of the 5 recommendations, and it's the first of the recommendations. And I do think that, if I can say so myself, that I think this sort of mobilization is really important in a foundational way to garner support on the various issues affecting children and affecting families, and getting the protections that we so desperately need. And if we aren't mobilizing folks and getting them educated about issues, then we're going to have a tougher time trying to gain momentum when we want to achieve our other recommendations, whether that's securing an economy that allows children to thrive in safer environments, or even building political willpower to institute governmental change that includes policies that are child-centered. So what I tried to do here is just condense the 3 common components for each of the recommendations, our rationale for each of the recommendations, the challenges and action steps, just as a framework for the presentation. And I, again, think this particular tenet is foundational for the work that we're doing. So the rationale for Mobilizing Society is just the simple fact that there's a need to address children's environmental health, knowing that children face unique vulnerabilities and susceptibility to toxic chemicals and pollution that can cause irreversible harm. We all know that. And then there are challenges. We have to be engaging in long-term organizing. We know that science is not always accessible to the public, whether it's because simply it's behind a paywall and you can't access it, or the jargon and the language is confusing and somewhat conflicting at times. So it can be difficult to understand. We have to recognize that. Resources to address these issues are competing with other issues on the table for policymaking. So again, resources are limited. And there can be a lack of a clear motivating message on children's environmental health. So those are challenges that the blueprint outlined for us, and some actions that it also, in a nutshell, calls for to develop a messaging strategy on key issues impacting children's environmental health, to launch a movement that raises public awareness, and to create a powerful network of traditional and non-traditional supporters. And I really like this last part about non-traditional supporters, and I will highlight some of that work today in ways that we can really amplify messaging on these issues to, again, mobilize people in this space. So 2 of the issues I'm going to highlight today, just for the sake of time, are one is an ongoing environmental health issue, the Flint water crisis, and work that I've done with Black millennials for Flint. And respectively, at Earth Justice, we're addressing an emerging, what I would consider an emerging child's health issue, which is related to immigration detention centers. And not that Time Magazine is an indicator of information, but I just wanted to note that these are salient enough issues that the public is getting access to this information some way or another. And I think it's really important that those of us in our respective spaces are helping to contribute to that conversation, especially if we are at the forefront of getting more information, whether it's from the science or from what's happening on the ground, through our respective work to be able to promote that to the public as well. So we already have part of our work cut out for us in that we are getting media attention, which I do think is really important. So that's why I'm just highlighting these 2 Time magazine covers here. So in talking about the Flint water crisis, I just want to remind everyone here that the crisis that we're facing in Flint is not over. It's not an issue of the past. And even though it's been over 5 years since we first understood that the water in Flint was not safe to drink, and that it's been the cause of dozens of water-related deaths, we also have to recognize that there's an entire generation of children who have been severely impacted due to the neurological harm from the lead in the water. And not only that, but these are children who have never known, there are some children who have never known what it's like to just turn on their tap to get fresh drinking water that they can know is safe. We know that the pipes have not been replaced, and of course that can't happen overnight. So there is a continued need for water resources in Flint. So that's just as a caveat as we're going into this conversation. And so here, I think this is likely familiar to many folks on this in this work, these 2 graphics that essentially explain why lead is so insidious. It's a powerful neurotoxin, and we know that it can damage nearly every organ and system in the human body, but especially the neurological damage is what we tend to focus on. Even at low doses, we know that harm is happening to the developing brain and nervous systems of babies and young children in the fetus, and it can also trigger in pregnant women miscarriages and stillbirths, and cause kidney and cardiovascular damage, as well as fertility trouble in women. And we see that even in Flint. The data reflects decreased fertility over the crisis over the past 5 years. So we also have come to understand the best available science tells us, and it's supported by governmental health organizations like the EPA and the World Health Organization, as well as the American Academy of Pediatrics, that there's no safe level of lead. And so when it is ingested, there is a transfer from the bloodstream to our organs and to our bones and teeth ultimately, which can also be redeposited in the bloodstream when women are pregnant. So even if there is not a current source of lead exposure at the time that a woman might be pregnant, if she has historical exposure, that lead can still impact the fetus. There are millions of people across the country who are served by community water systems that have exceeded EPA standards for lead in drinking water, but we also know that that standard is far too high and is subject to revision at this time. And so here again, I'm just highlighting some of the ways in which lead can be can cause great harm. And while this presentation will focus specifically on drinking water issues in Flint, I would be remiss if I didn't at least say that there are many other sources of lead in children's environments, including lead-based paint in homes that have yet to be remediated, in soil from fencing that might be outside, or from historical contamination from incinerators, smeltering, or leaded gasoline. But then also more unlikely places that we might not be thinking about in toys, imported goods, and even take-home exposures depending on where people are working. Because of children's activity, we know that they're also doing hand-to-mouth activity that also increases their likelihood of exposure. So I, again, am framing this maybe as information that is not new to many on the phone, but I do want to give us that context for why, again, this is such an insidious issue. And I will also acknowledge that I'm focusing on Flint, but there's a burgeoning crisis in North New Jersey and other communities, hundreds of communities that have been identified by EPA as having exceeded lead levels. So this will be an ongoing issue. So my work with Black Millennials for Flint as a co-founder, we were founded in the wake of the Flint water crisis, which is why Flint is in our namesake, so we don't only operate in Flint. We were founded in 2016, and we're the first and only African American and Latinx civil rights and environmental justice organization in the U.S. that advocates for the eradication of lead. And part of that work is to, as our mission shows, to empower people to take action and to advocate against the lead crisis plaguing Black and brown communities especially. Our work is approached from more of a local perspective. We engage community-based groups, activists, and local governments in order to provide technical assistance to affected communities with the goal of reducing lead exposure. And our 4-point action plan here just highlights some of the ways in which we at our core that we function. First and foremost, by raising funds and cultivating resources, not always funds, but curricula and other information that can help to improve the quality of life in communities impacted by lead exposure. Doing our work in advocacy to eradicate lead in all of its forms in all of the forms that we know people can be exposed. Of course, educating and equipping people who know what to do and know what lead exposure is, and then to build coalitions with like-minded organizations. We're a small organization. We definitely can't do this work on our own, so we partner with great organizations, including CEHN and many others. So I'll just highlight that we have focused greatly on work in DC related to providing policy recommendations for lead in drinking water in schools. There was a Childhood Lead Prevention Act passed in 2017 by the DC Council that requires testing and remediation for lead in drinking water in both public schools, charter schools, and other places that children frequent. And we've done other work in cities like Memphis where we've established a lead prevention commission. We have included 2 now cohorts of lead ambassadors across 4 cities in the U.S. that will help to educate folks to go back to their cities and do work on lead issues in their own communities. So that's just a little gist of some of the work we've done for Black millennials for Flint. So the next couple of slides will mainly be to give you some context about what it's been like doing work in Flint. We took our first trip to Flint in 2016, and this was about the time that the media and public were becoming aware of the issue. It was getting more national attention. It wasn't just a local issue at this point. And I just want to remind people that the lead in drinking water in Flint had been an issue since 2014. So when we're talking about the need to mobilize, if we aren't aware of these issues, it can be too late for those who are going to be impacted. But we did what many groups did in the beginning, which was to try and provide direct resources, so water, sanitary wipes and baby wipes, and things of that nature, because folks at that time were not even using water for bathing, or were not using tap water for bathing and things like that. So we literally drove from DC. We had youth with us. Actually, in this first picture on the top left, those are some of the youth we took from DC middle school who were interested in doing their part to help with distributing water and going door to door, canvassing to get information from residents who might have been disabled or senior citizens who could not make it to water drives. So we wanted to make sure we were getting information from folks to provide to those groups on the ground that can go door to door and provide drinking water for those who can't make it to physical locations. We attended a community meeting where understanding, I think, the community needs and what were some of the goals of the community, not coming in and saying we had answers, but trying to understand what they think and needed as answers and what assistance they needed. We also, at that time, had a large food drive, and so many food items were donated, and as we know, nutritional intervention can be really effective and helpful in addressing lead and trying to make sure to buffer in a way against the effects of lead once a child is exposed. And again, here it's just the many thousands of gallons of drinking bottled water that we were able to bring at that time. So that was in 2016, and we have visited and provided resources every year since, and we've also deepened our connection and ties to the community. This past April, around Earth Day, we did our 4th annual weekend of service. To date, we've donated close to 50,000 gallons of water. We've partnered with youth like Mari Coatney, Little Miss Flint, to execute these types of water drives, as well as our partners in the faith-based community who have really stepped up in this time to help to provide drinking water and to be a haven for residents who may lack resources. They actually do donate water several days a week, and because of their work and because of our strategic partnerships, we were able to connect and establish a partnership with Jaden Smith and his foundation to bring the water box to Flint, which is essentially a mobile water filtration system that can reduce heavy metals like lead and eliminate bacteria from water. So it's designed to be portable. It can be replicated with actually just supplies you find at the hardware store. It's even designed in a way where its blueprint will be released to the public, so it can be, again, designed in other communities, will not be patented and inaccessible to the community. And so that was a $1 million contract that we were able to help secure for the community. We launched that effort this year, and so far have donated 3 water boxes to Flint, and then 2 right now are actually operational. So just to wrap up, the community is still very much dealing with ongoing harm. There's still major distrust decision makers because the lead in service lines have not been replaced, and that's the ultimate solution. There is still a great need for our elected officials to continue to engage, but also for the public to engage to meet the gap and bridge the gap that still exists for those who are impacted by the water crisis, both in Flint but in other communities as well. So with that, I will wrap up with my other topic, which is an emerging children's environmental health issue related to detention centers in the U.S. And so here I'm just using a graphic to show when we're thinking about root causes of issues, often we in some ways in the health community can come in when there's already an issue, and we want to talk about prevention, but prevention is not always about exposure. Prevention also may include having to get at root historical causes that may be outside of our own issue areas. So in this case, when we're thinking about an increase of immigration into the U.S., part of that is driven by poverty and hunger, especially in countries like Venezuela, Guatemala, El Salvador, and Honduras. And we know that especially hunger is a major children's health issue. And when we talk about vulnerabilities in addressing children's health and healthy environments, I think we have to include nutrition as a huge component of health, because we know that with inadequate nutrition, it can only exacerbate susceptibility to illness, and we see that with things like lead poisoning. And with adequate nutrition, you can actually help to buffer against adverse harms. So as we're thinking about this issue, I think we have to also ground it in knowing that we're contending with globalization, we're contending with resource depletion, we're contending with climate change and other types of issues that are just going to that continue to make children more and more vulnerable. So I just wanted to highlight some of the root cause before we get into the issue of detention centers. Some of the work that Earth Justice has been involved in is related to understanding that this current policy of forced family separation and the current administration's zero tolerance on immigration policy basically creates this additional capacity that's needed to house migrants who are at the U.S.-Mexico border. And the sort of outcry of separating migrant children from parents is what has ultimately involved the Department of Defense and Homeland Security and this need to say, or at least from the government to say, where are we going to actually house children? So what we've come to learn, very disturbingly, is that the administration has done site planning at a number of military sites, including the Goodfellow Air Force Base in San Angelo, Texas, and the Fort Bliss Army Base in El Paso. After filing Freedom of Information Act requests, which we were hoping to gain information to know what was actually the state of affairs, if you will, especially in terms of the environmental contamination at many of these military installations, because that's very common on military sites, that there are existing Superfund sites on military installations. And so that concern has triggered a need to get more information and to also sort of spin the process, if you will, of the administration moving forward with housing children and what we're calling toxic cages. Some of our partners in this work include the National Hispanic Medical Association, Labor Council for Latin American Advancement, and Green Working Group. And I'll say that there are other groups that we are partnering with, and some, again, who are unlikely, who may not have partnered with before, but it's really important to engage those in other spaces to amplify this work. We know that the proposed detention centers will be using tents to house the children, since they're technically temporary, but temporary can be actually quite a long time. And tents will not be adequate to protect against the type of exposures that might be experienced when you're placing them on top of contaminated sites like a former landfill, near a fuel storage facility, and near a small arms firing range. And from what we have come to understand is that the soil and groundwater are contaminated with lead, arsenic, benzene, PFAS, and other VOCs, which we know can cause vapor intrusion. And so these types of harmful contaminants that have been detected, we know they can cause neurocognitive deficits in children. They affect the immune system. They can cause cancer and have many other developmental impacts. And so the other, I guess, way I will frame this is that going back to nutrition, the other thing that children are contending with is trauma. They're contending with the fact that they're making this journey here. They may not be in optimal health when they arrive, and so they will face immense challenges from not only being separated from their parents and guardians, they may be malnourished and dehydrated, and so that compromised physiological state only makes them more susceptible to acute stressors and acute mental stressors. And so that is some of the way in which children are just more vulnerable, more susceptible, and that is not addressed in much of the work that we know is happening to do site testing at these particular military installations. So just quickly, I will show you a graphic of one of the sites that have been identified. This is the Goodfellow Air Force Base in San Angelo, Texas. The green area shows the actual proposed center, and you'll see that it overlaps with a known landfill. And this landfill is not contained. It's, again, on top of a known Superfund site. We know that, at least from some limited records, that these sites have not been completely cleaned, that there has been some air monitoring that has shown vapor intrusion to be an issue from groundwater and drinking water and soil, and that some of the adjacent sites actually may need to be expanded in terms of the extent of contamination that is present on the base, so even beyond the highlighted areas that you see here. So that's just to give you some context about one site that we know of. Again, there actually is another, including the Fort Bliss site and a Homestead military base in Central Florida. So part of the work, again, in thinking about challenges and even some successes, challenge here is that when you're dealing with especially an agency like the Department of Homeland Security, we are going through active litigation essentially to get information. This is not a lot of publicly available information, and there are some restrictions to what we even have access to even with under court order, and even delays in response that we've received from specifically the Army related to the Fort Bliss Army base. We have been able to get some media attention on this issue, which has been really helpful. We've held a press conference. There was actually one held recently on the Homestead issue by a partner organization in Florida. We have testified at the U.S. Commission on Civil Rights. This is another sort of, if you will, unlikely partner in that they have a unique authority where they can request information from all governmental agencies that is mandated under their particular work. And so we have essentially gone to them and asked if they can do any type of request for information that can help us understand and help the public to understand what's going on these sites. And while the U.S. Commission on Civil Rights was involved based on some of the atrocities related to forced family separation and what's happening physically at the detention centers, they are now engaged on understanding and seeing if there's a need to prevent certain sites from being used to house migrant children. So I think that's in partial ways of success. I will say that I think a success when we're slowing down the process and slowing down the administration from moving forward on this work is a part of it, what it would be considered a success. And of course, continuing to raise public awareness is important, but there's still the continued challenge. Our work is threatened in that this particular site, after the site identification moves forward, we may not know what's going on in the process until permits and other things are issued. So it's an ongoing effort that we are tracking and trying to raise more awareness around because it is certainly an emerging children's environmental health issue. So I'll wrap up with just some key takeaways going back to one of our first slides on the blueprint. I think the blueprint definitely gets it right on this issue around mobilizing society to act on children's environmental health. We have to create compelling messaging. We have to highlight stories on impacted communities to communicate key environmental health issues that children face. And that said, impacted persons and communities have to be given a voice. Their voices must be amplified in this work because they're local leaders. They can make things happen on the ground. And so that is, I think, a really important way to galvanize in this work. Youth are effective communicators, and so highlighting their voice and giving them a platform can be a really effective strategy to raise awareness. Of course, using social media, the news, we use public meetings, we testify, literally go door to door to give out information. Anything we can do to spread the word on these issues and mobilize people to action, all of that needs to continue. And again, I highlighted this earlier, but engaging, especially non-traditional supporters, has been a really effective way, I think, to amplify awareness because you can find synergy around different issue areas and helping to, again, prioritize and center children at those issues. Many organizations support that work and are just looking to learn more about how to best message and move that work forward. So with that, I will wrap up and thank you again to everyone on the call and to CHN for this opportunity. I look forward to our question and answer period.
Thank you so much, Michelle. And just as a reminder, please put your questions for Michelle and Kristin in the chat box, and we will make sure that we have some time towards the end to address a few of those. And thank you so much, Kristin. You're on.
Great. I want to add my thanks to Michelle for that great presentation, and thanks so much to NSA and to Christy and to the Children's Environmental Health Network for organizing this important conversation. So my name is Kristin Schaeffer. I'm Executive Director of Pesticide Action Network. I've been at PAN for over 20 years, and as NSA noted, I've held various roles. My program work has always had a particular focus on children's health. So next slide. I'd like to start by sharing just a few things about PAN. We are a national nonprofit organization. We have offices in Minnesota and California. You see our mission statement on the screen. We work in 4 key agricultural states. That's Minnesota, California, Iowa, and Hawaii. And we also conduct national campaign work. And we're celebrating our 35th anniversary this year. Next slide. So PAN is part of a global network that was founded in Malaysia in 1982, and there are now centers in Latin America, Asia, Africa, and Europe in addition to our office here in the U.S. Next slide. So these are our current programs here in the United States, and for all of this work we bring 3 core capacities: grassroots science, strategic communications, and coalition organizing. And I'll dive into exactly what this looks like as we move through the chlorpyrifos story. Next slide. So today we're going to look at the story as a case study of mobilizing to protect children's environmental health. So this hard to pronounce pesticide has been in the news a lot over the past few years, most recently because after many years of pressing for action, we've had some significant wins that will protect the health of hundreds of thousands of children in agricultural states. So before we dive in, I'd like to note that there have been many, many groups and individuals across the country involved in the fight to protect children from this chemical. And I'll be recognizing some of these partners throughout the story, but I won't be able to mention them all. Next slide. So we'll start our story in 2001 when household uses of chlorpyrifos were withdrawn. So scientific studies had shown at that time that women exposed to chlorpyrifos during pregnancy were more likely to have children with smaller head circumference, which is often an indicator of neurodevelopmental harm. So EPA negotiated a withdrawal of all household products with Dow Chemical, which is the corporation that manufactures chlorpyrifos. Next slide. So the scientific evidence linking chlorpyrifos with neurodevelopmental harms continued to grow, and yet children in rural areas were still being exposed. So chlorpyrifos is used on a wide range of crops. Some of the highest uses are in production of citrus, nuts, grapes, peaches, corn, and alfalfa. More than half of all apples and broccoli are also sprayed with chlorpyrifos. It's a very volatile chemical, so it often drifts from fields where it's sprayed into homes and schools in rural agricultural areas, and it can also contaminate water. So in 2007, we worked with the wonderful lawyers at Earth Justice to file a legal petition alongside NRDC demanding that EPA protect children in rural communities from exposure to chlorpyrifos just as they had protected children from household products. Next slide. So even before filing the lawsuit, our grassroots science program had been working with communities in many states, California, Hawaii, Florida, to document chlorpyrifos drift. So we used our drift catcher, which is a simple device that you see in the photos here, that was invented by Dr. Susan Kegley, our senior scientist at the time. So coordinating with state coalitions like Californians for Pesticide Reform, we worked with local community groups to train their members to set up the device near their homes or near schools where we knew or suspected chlorpyrifos was being applied. So the passive air monitoring device would capture and measure the level of chlorpyrifos and its breakdown products in the air. Those samples were then sent to an independent lab for analysis. And we'd then share the data when they came back with the communities and work with them to develop strategies to use the findings for advocacy campaigns if that's what they wanted to do. Many did, and this grassroots science became the basis for much of the organizing work we'll talk about in a moment. So I wanted to mention in California we also had a small collaborative biodrift project where we worked with our partners at Commonweal who have expertise in biomonitoring, as well as with a community-based organization in the small town of Lindsay in California's Central Valley to measure chlorpyrifos and other chemicals in their urine at the same time the drift catchers were deployed, so leaving no room for doubt that these families were being exposed to harmful levels of this neurotoxic pesticide. Next slide. So another focus of our grassroots science work is translating scientific studies into more accessible language that can be used in our advocacy work with partners. And this was mentioned in the blueprint that Michelle highlighted, the need for accessible information based on science. So our staff scientist, Dr. Emily Marquez, was lead author for both of these reports, and I was one of her co-authors. For A Generation in Jeopardy, we reviewed more than 200 studies linking pesticide exposure to a variety of children's health harms. And we found the evidence was strongest for increased risk of two particular health outcomes. One was childhood cancers, and the second was neurodevelopmental harm. And because it is so widely used, many of the studies we reviewed that were exploring the harms to children's developing brains and nervous systems were focused on chlorpyrifos. We found that the evidence was particularly strong, showing that prenatal exposure to chlorpyrifos was linked to learning disabilities and lower IQs, increased risk of ADHD and autism. So by 2012, which is when we released A Generation in Jeopardy, there was also evidence that risk of these harms was elevated even at the low levels of chlorpyrifos that were found as residues on fruits and vegetables. So in 2016, we released Kids on the Front Line, which updated our review of the science and focused in on evidence of exposure and harm in rural agricultural areas of our 4 key states, so Iowa, Minnesota, California, and Hawaii. Next slide. So now I'd like to shift to some examples of strategic communications as part of this work. So getting this information, this science out into the world effectively was a key part of our campaign. So we released both of these reports, for example, with partners across the country and used the findings to produce fact sheets and blogs. We hosted webinars like this one highlighting the findings. We landed some earned media coverage, placed op-eds in key outlets, did radio interviews, and so on. We also used our Ground Truth blog, which is distributed to about 70,000 people across the country, to unpack key findings and cover emerging new science. And that's Emily Marquez, our staff scientist, at the microphone there. Next slide. So online organizing is also a key part of our strategic communications work. So we mobilize pressure through petitions, direct emails, and social media, so-called Twitter storms, targeting EPA, targeting Congress at the national level, and state agencies and legislators or the governor's office in our state level campaigns. And we'll often coordinate these efforts with partner groups to have the most impact. Next slide. So one more key component of our communication strategy is to connect people to the issue by lifting up stories of people who are directly affected. So in the case of chlorpyrifos, one of these stories was Bonnie Wirtz in Minnesota. So Bonnie and her husband and their young child Jaden had just moved to rural Minnesota to start farming when their neighbor applied chlorpyrifos to his alfalfa field and it drifted into their home. Bonnie and Jaden both had severe acute reaction to the chemical, and they experienced breathing difficulty and chest pain and were taken to the hospital. So Bonnie reached out to PAN for help, and the next season we worked with her to place a drift catcher near her home, and she documented chlorpyrifos levels in the air well above the level that EPA considered safe for children, even though her neighbor was following all the requirements on the label. Bonnie and her family gave up their dream of farming, moved back into the city, and she began working with her mom's group to educate others about pesticide exposure and potential impacts on children's health. And Jaden, who now I believe is 8 years old, was diagnosed with learning disabilities a couple of years ago. So that's just one example of using an individual's story who is directly impacted to lift up the issues that we're facing as we do our campaign work on chlorpyrifos. Next slide. So in addition to strategic communications based on science, we also do organizing. So in this case, we worked with coalition partners like Californians for Pesticide Reform and the Protect Our Keiki Coalition in Hawaii to bring both scientists and members of directly affected rural communities to briefings and meetings with legislators in Sacramento and in Honolulu. We hand-delivered petitions and held meetings with state and federal officials. Next slide. So in response to our original 2007 lawsuit, and after several court orders to act in the face of a, quote, egregious delay, EPA finally took action. And after reviewing the scientific evidence that was now available, they concluded that infants were being exposed through their diet to chlorpyrifos at levels 100 times the level considered safe. Water was contaminated at concerning levels, and farm worker health was at risk, even when chlorpyrifos was used as directed, meaning all rules were followed when it was applied. They then recommended all uses in food production be withdrawn and set that process in motion in 2016. And then in his first public action, the new EPA Administrator Scott Pruitt reversed this decision and blocked the planned ban, the national ban, in March of 2017. Next slide. So we immediately took EPA back to court, this time joined by a number of farm worker organizations, including United Farm Workers and Farm Worker Justice, as well as attorneys general from several states. We demanded that EPA act to ban chlorpyrifos within 30 days, since they had reversed the planned ban without any new scientific findings that disputed their own science that showed that the chemical was unsafe. So the judges initially found in our favor and ordered EPA to act. The agency, of course, appealed, and a current ruling is allowing Pruitt's action to stand. We filed another suit, and the legal battle continues. Next slide. So both EPA's 2017 decision and the ongoing legal battle have made mainstream media headlines, and PAN and our partners have successfully gotten the issue covered with our framing. The Guardian, for example, did an in-depth story featuring the voices of women in the Central Valley of California whose families have been exposed to dangerous levels of chlorpyrifos for years, responding to this decision at the national level. Next slide. And we kept organizing. We worked with our partners at Earth Justice to bring representatives from affected communities to Washington, D.C. to meet with legislative staff and to participate in a briefing and a press event announcing national legislation to ban chlorpyrifos. So in the photo there on the right, the woman with the green shirt is Representative Nydia Velazquez, who sponsored the House bill. And on the left, that's me with Bonnie Wirtz from Minnesota and Senator Udall, who sponsored the bill on the Senate side. So both have reintroduced their bills this past January, and we continue to encourage legislators to support this legislation since EPA is refusing to do its job. Next slide. And at the same time, across the country, groups that are concerned about children's health have come together to call on their state officials to take action on chlorpyrifos. So you see the long list of states there where there's been organizing for state policy change, from Smart on Pesticides in Maryland to the Protect Our Keiki Coalition in Hawaii. Groups have coordinated meetings with legislators, mobilized phone calls and emails from members, and waged media and social media campaigns. Next slide. So in June 2018, Hawaii became the first state in the country to ban chlorpyrifos. That legislation also included a buffer zone around schools for all pesticides and also notification requirements. So it went beyond just a chlorpyrifos ban. Next slide. So the New York state ban passed next and is currently waiting for the governor's signature. And then in May 2019, the California governor's office announced it would cancel registration of chlorpyrifos in the state. And this is a critical milestone because California uses more chlorpyrifos than any other state, with an estimated 1 million pounds per year on about 60 different crops. And bills came close to passing in several other states, including Oregon, Maryland, and many of the others listed in the earlier slide. And many of these are well positioned to be reintroduced in the next legislative session as momentum continues to build. Next slide. So just some final thoughts to wrap up. So first, just to underscore that it's very clear that strong science alone is not enough to win children's health protections. It's clearly necessary and extremely important, but needs to be combined with these other elements to move us forward. Communications tactics that are creative and engaging and based on core values are incredibly important. And it's critical, the organizing with communities that are most effective, and Michelle mentioned this as well, is always a key part of effective campaigns. That's where the best solutions are, the folks that are directly impacted, and the most powerful progress can be made. I do want to highlight we don't have lawyers on staff, but we're finding legal action in our campaign work is increasingly important, and we so appreciate our partners at Earth Justice and NRDC and also the Center for Food Safety for bringing this capacity to our collective work. And clearly persistence is a key part of our success as well. Just a reminder that this story started back in 2001. Next slide. So folks may recognize this photo of President Trump handing his pen to the CEO of Dow Chemical after signing one of his early executive orders setting in motion rollbacks of health and safety rules across the agencies. There's a clear link and direct link to our story of chlorpyrifos here, as we know that Dow officials met with Administrator Pruitt just weeks before EPA reversed the national ban. But I wanted to close with this image to highlight a broader issue and challenge. So if our public agencies were working to protect the public interest, it would not take 18 years of campaign work to protect children from a chemical like chlorpyrifos. So we believe we need a fundamental reset of the current system that takes corporate lobbyists out of the picture and directs agencies to actually do the job they were set up to do, which for EPA is to protect public health and the environment. Next slide. So I will close there. These are some links for folks who want to learn more and get involved, and I look forward to your questions. Hopefully we have a few more minutes for question and discussion. Ense?
Thank you so much, Kristin. I really appreciate both of these talks, and we've got a few questions that have come in. If there's any more, just type them in real quick. Kristin, we can start with you from Jean Marie, and she first says, thank you for your excellent work. But she says chlorpyrifos is also used at times for mosquito spraying, which is sometimes even endorsed by health departments. If agricultural drift of the chemical causes cancer, autism, ADHD, and lower IQs, we can assume drift from mosquito spraying does the same thing. Is PAN looking at mosquito spraying practices?
That's a good question. And first let me clarify that when I mention the childhood cancers, so there are other pesticides that are more directly linked to increasing the risk of childhood cancers. The evidence for chlorpyrifos is really strongest around these neurodevelopmental harms. And then to answer the questions, it's clearly concerning the issues of the public health uses of pesticides, and you know, often helicopters will spray over neighborhoods. Clearly there's direct impact. That is something that we have done some work on. Our focus has been more on the agricultural uses, and our partners at Beyond Pesticides have been focusing more specifically on issues of vector control and so on, and alternatives, and doing advocacy around that bundle of pesticide uses.
Thank you. And Michelle, John asked, might you comment on the associated Legionnaire's disease in Flint, if you're able to?
Sure. I hope you all can hear me. I think it's actually now getting a bit more attention because of a new special on PBS that is showing that there was likely misclassification of some deaths during the outbreak period. So Legionnaire's in and of itself is attributable to a waterborne bacteria, and it's understood that the switch from Flint's drinking water source of Lake Huron to the contaminated Flint River, and then the subsequent inadequate chlorine treatment by the water utility was the link between the documented outbreak, I should say, of the Legionnaire's disease, which happened between 2014 and 2015. So we'll sort of remember that the crisis itself started in 2014, so this is early on. I believe the estimates currently are close to about 90 people, I want to say, have been have at least been sickened by, but not necessarily have died from Legionnaires. But it's a type of pneumonia. It can be fatal, and so the official numbers were in the low, about a dozen or so initially during the year of the outbreak, and this new special is showing that when you really look at what symptoms people had been linked with when they were hospitalized and they have died, things like kidney failure, heart disease, and lung disease, those are also associated with Legionnaires exposure. And so again, there's now an unearthing, at least from the media, on likely mischaracterized or misclassified deaths that would raise that toll by the dozens. So that, I think, hopefully answers some of the way in which Legionnaire's disease is associated with Flint.
Thank you. And I don't see any other questions, and we are just at the top of the hour. So again, I want to thank everyone who participated, and especially our two wonderful speakers, and Christy Truesdale and Shanita on our staff who helps to promote the webinars. Here are some links that may be helpful. Please do consider, if you're not already a part of our Children's Environmental Health movement, there's a link there on our site. Please do take action to support children's environmental health in our Act Now page, and we've identified some opportunities through our partners as well. And consider attending our next webinar, and we've told you about Children's Environmental Health Day. So thank you all so much. Have a wonderful day.